So this is Erudite Anatomy series where we make anatomy so easy, make fun with anatomy. Okay, so let's continue from where we stopped. So let's look at muscles of the shoulder. So first of all, muscles of the shoulder are six, and I call them 6GT. So these six are called rotator cuff, rotator cuff muscles, rotator cuff muscles. Okay, so let's continue. So the first one here is, let's start with supraspinatus. So this is supraspinatus, infraspinatus, teres minor, subscapularis, deltoid, and teres major. Please don't confuse this T as teres major. It's minor. The teres in the rotator cuff is teres minor. Okay, so if you come to supraspinatus, so first of all, if you remember, let's say this is scapula. Okay, so let's say this is scapula. Um, okay. So this is how to know the back of scapula is through the spine. So this is spinous process. So this is the upper lip of spinous process, lower lip of spinous process. When we do the um, trapezius, I told you that trapezius inserts the superior fiber. That is the superior fiber of trapezius insert at this upper lip of spinous process. Okay, so this is supraspinous fossa, this is infraspinous. So what you have to know is that infraspinous fossa is actually bigger than supraspinous fossa. Infraspinous is bigger. Then if you look at this, you see something, there's a notch here, suprascapular notch. Then this suprascapular notch, there's a ligament converted this notch into a foramen. Then you now see that they normally ask you which vessel passes through suprascapular foramen and which one passes above suprascapular foramen. The one that passes through is the suprascapular nerve. So the nerve will pass through here, suprascapular nerve, supplying the supraspinatus here. Then this is another opening, actually, so the sphenoglenoid foramen. Then now pass from here through this sphenoglenoid foramen to supply the infraspinatus. So you know that suprascapular nerve passes through the foramen while the vessel passes above. So the muscle that picks origin here is, so supraspinatus, the origin is what? Supraspinous supraspinous fossa. Then if you come to insertion, I want you to know that this sits, this supraspinatus, infraspinatus, and teres minor, all of them insert at the greater tubercle. This is, for example, this is greater tubercle. Then let's say this is lesser tubercle. Then this groove between two of them is called a bicipital groove. It's called bicipital groove. Okay. So as you can see, let me list the muscle that it attaches here. So this is six. Remember, this is the greater tubercle, this is the lesser tubercle. Then subscapularis attaches and inserts at this lesser tubercle. Then remember, this is bicipital groove. You understand? So this is, let's say towards this side is lateral, then towards this side is medial. You see that this is what? lateral lip of bicipital groove is P major. Then then this median lip is Rs major. Then this floor is latissimus dorsi. So from this greater tubercle, lesser tubercle, and the groove between them, you can see how many muscles already. One, two, three, four, five, six, seven. So seven muscle, it starts here. Okay, so this greater tubercle analysis for insertion and the bicipital groove. Then we have talked about the origin of this guy, supraspinous fossa. Then insertion, you already know is what? Upper part of a greater tubercle. Then nerve supply is what? You already know nerve supply is a suprascapular nerve. Suprascapular nerve. You know, remember I told you first of all pass through this suprascapular foramen, supply the supraspinatus, then pass through sphenoglenoid notch, or you can say sphenoglenoid foramen, then and then supply what infraspinatus. Then action, the action of this guy is that this guy does, I think we'll be saying it, does 0 to 15 abduction, 0 to 15 abduction on the arm, 0 to 15 abduction on the arm. Remember, I told you the arm is used interchangeably with the humerus or what? The shoulder. Okay, then let's continue. We are done with the origin, insertion, nerve supply, action, then unique feature. So, unique feature of this guy is that number one is that this guy is not actually a rotator of the arm. As you can see, it is not an abductor of the arm. So, it initiates 0 to 15 abduction of the arm. Another unique feature is it is the commonly ruptured tendon in this rotator cuff. It's the most commonly ruptured tendon, commonly ruptured. So rupture of this tendon is called supraspinatus tendinitis. Supra supraspinatus tendinitis, also called painful arc. Supraspinatus tendinitis, also called painful arc. And degree the degree range of painful arc is 0 to 120 degrees. Okay, then I think we're done with supraspinatus. Then let's talk about the second muscle, which is infraspinatus. You already know the origin. The origin is spinous fossa. Insertion is the middle aspect of greater tubercle. Nerve supply is suprascapular nerve. Action is number one is action of infraspinatus. You remember, let me tell you generally what this rotator cuff does. Let me tell you what this rotator cuff muscle does. Okay, let's say for example, um, let's say this is scapula. So are you seeing look at the head of the scapula? Sorry, the head of the humerus. This is the glenor cavity. So are you seeing the ratio here is 4 is to 1. So the head of the humerus is 4 times bigger than what the glenor cavity of the scapula. So what this rotator cuff muscle does is that they ensure firm fixation of the head of humerus, sorry, through the what into the glenor cavity of the what of the scapula. Then so one of the action of supraspinatus is what? Being a rotator cuff, it helps in what? Firm fixation of the head of the humerus into the glenoid cavity of the scapula. Then the second one, it helps in what? Adduction and lateral rotation of the arm. Lateral rotation of the arm. Then the number three muscle, okay, I think we're done with the origin, insertion, nerve supply, action. No action, no unique feature about this guy, no special thing. I can't remember any special thing about this guy. Then let's talk about the third one, which is Terence Minor. Terence Minor. Okay. Terence Minor, the origin. See, if you remember, uh, um, remember we say we have media border of the scapula and we have a lateral border. Remember if, when we came to the when we were talking about the median border, we said that median border has an anterior aspect and that is ventral and posterior ventral and dorsal aspects. If you remember, this median border is an insertion of muscle. What inserts at the ventral aspect is serratus anterior by its digitation. Remember how I explained it? Then the dorsal aspect is for insertion of what? All the muscles supplied by dorsal nerve, which are what? Levator scapula from the superior angle to the level of base of spine, then rhomboid minor at the level of base of spine, then rhomboid major from the level of base of the spine to the what? Inferior angle. So medial border, one muscle inserts here, three muscles insert here. If we come to this guy, we still have what? Ventral and dorsal aspects. Actually, no muscle as inserts at the what? Dorsal as ventral aspect. If you go to this dorsal aspect, is divided into upper two-third and lower one-third. Upper two-third, the muscle that originates actually here is one another thing difference here is what? The lateral border gives origin to muscle, while the ventral border gives insertion to muscles. So muscles are inserting here, muscles are originating here. So upper two-third gives origin to teres minor, while lower one-third gives origin to teres major. So it's not hard. Okay, then if you come to teres minor, you already know the origin. The origin is what? Upper two-third of dorsal aspect of lateral border of the scapula. Then insertion, you already know the insertion is lower part of what? Greater tubercle. Then you already know the nerve supply. It is what? Nerve supply is axillary nerve. Remember axillary nerve supply teres minor and deltoid. Then the next one is the action. Action is the same thing with this guy. So both adduction and lateral rotation of the arm and also being a rotator cuff muscle, it helps in what? Femtorization of what? Head of humerus into the what? Glenoid cavity of the scapula. Then the next one is unique feature. Unique feature of this guy is number one is its origin is a popular asked question. Its origin is transversed by circumflex scapular vessel. Or you say its origin is interrupted by a circumflex scapular vessel. Then another unique feature of this teres minor is that okay, the one with the axillary space, you see that it forms the what? The upper border of quadrangular space and upper triangular space. So it forms what? The upper boundary of a quadrangular space and upper triangular space. So that is all about this teres minor. Then subscapularis. Remember the back of the scapula, the front in front of the scapula is what? Is subscapular fossa. Remember the back of the scapula, how we used to know it is the spine. So the front is now subscapular fossa, while the back that is now divided by spinous process is what? Above is supraspinous fossa, below is infraspinous fossa. Then let's now continue with so the origin of subscapularis, which is this one, is so if you come to subscapularis, so its origin is what? Subscapular fossa. So then its insertion, you already know is what? Lesser tubercle. Then nerve supply. So this guy is a hybrid muscle, both upper and lower subscapular nerves. Then action, it does adduction and medial rotation of the arm. Then unique feature, what is unique about this guy? It is called is has a unique name. It's called hugging muscle. Maybe I think the reason Phoebe say the reason is like is because this guy does medial rotation of the arm. Then also this guy subscapularis. Another thing about subscapularis is that it forms the lateral wall of the axilla. If you remember, the lateral wall of the axilla is formed by SLT. Abi? So it forms the lateral wall of the axilla. So it means subscapularis, latissimus dorsi, and teres major, they form lateral wall of the axilla. So I think we're done with the what? Rotator cuff muscles. Then if you come to the, I want to do teres major before deltoid. So teres major, what do you have to know about it? Origin, you should already know it. Is the origin is should not be what? Lower one third of the what? Dorsal aspects. Lower one third of dorsal aspects. Lower one third of the dorsal aspects of the lateral border of the scapula. If you remember, the upper two third of the dorsal aspect of the lateral border is by what? Um, the teres minor. So I done the origin in the insertion. You already know the insertion is medial lip of bicipital groove. Medial lip of bicipital groove. Then nerve supply is lower subscapular nerve. So lower subscapular nerve. So that is what supply. Then the action just is same thing with this guy, everything. So it does what? Adduction and the medial rotation of the what? The arm. So what did you notice about, okay, don't worry, I'm going to do a bit of summary. Then unique feature. So this guy is a hybrid muscle. So it's a hybrid muscle. So hybrid or composite muscle. So muscle that have two nerve supply. Then another thing about this guy is teres major. Okay. So teres major, look at it. One with that exact space you understand. It forms the what? The lower boundary of upper triangular space, the lower boundary of quadrangular space, and the upper boundary of lower triangular space. So the lower boundary of both quadrangular and low and upper triangular space, but the upper boundary of a lower triangular space. Okay, then which other one? So let's look at the last one, which is deltoid. So deltoid, you already know the origin. Remember we said that the insertion of trapezius is inverse to the origin of deltoid. So it means that this guy is going to originate from number one is what? Anterior aspect of the medial half, sorry, anterior aspect of the lateral half of the clavicle. Then number two should now be what? Mid lateral border of acromion. And number three is inferior lip of the spine. You know, if you invert it, this is the insertion of trapezius. So you know trapezius inserts the upper fiber of trapezius inserts at the posterior aspect of lateral border of the scapula. Then the middle fiber inserts at the what? Medial border of acromion. While the inferior fiber, you understand? Inferior fiber now insert at the what? Superior lip of the spine. Then this is the origin of this guy. Then insertion is So you will normally say that this guy has V-shaped origin. Look at V-shaped origin, meaning this guy is this first one, this is the first one, second one, third one. So you have V-shaped origin and V-shaped insertion. So the V-shaped insertion is at the deltoid tuberosity. Deltoid tuberosity. Deltoid tuberosity is at the lateral aspect of the mid shaft of the humerus. Then this is the origin is insertion. Nerve supply you already know is what axillary nerve. Then action. So this guy has a anterior fiber, middle fiber, and posterior fiber. So anterior fiber does um, flexion and medial rotation of the arm. Then posterior fiber will now do extension and lateral rotation of the arm. Lateral rotation of the arm. Then middle fiber is the one that does a 15 to 90 degrees, 15 to 90 degree abduction of the arm. Do you understand? Okay, then what is the next thing? Unique feature. So unique feature. You need to know unique feature about this guy. Okay. So the unique feature about deltoid, number one, it is called muscle of regimental badge. Regimental badge. Meaning this here, this muscle here. You know, this is where the all those regimental badge of police people, right? For armed forces. That's where they used to put the badge. Then number two, you say is a muscle of intramuscular injection in the upper limb. Muscle of intramuscular injection in the upper limb. Now, when we reach lower limb, you see that the muscle of intramuscular in the lower limb is gluteus medius for adults. Do you understand? But anterolateral aspect of vastus lateralis for children. So this guy again, and remember this intramuscular injection is given 4 cm below the acromion. 4 cm below the acromion to avoid damage to axillary nerve. Avoid damage to axillary nerve. So it's given 4 cm below the deltoid to avoid damage to axillary nerve. Then the next thing about deltoid, number three, you have to know that this deltoid covers a lot of structures in the what? In the shoulder region. So it covers a lot of structures in the shoulder region, like coracoid process and the muscles attached there. So if you remember, muscles attached at the coracoid process in BCP, shorted of biceps, coracobrachialis, and what P minor. Why these two are originating from the tip of the coracoid process, this guy is inserting as the word anterior aspect of the medial border. Then another thing that this guy covers is that it covers the rotator cuff muscle. Don't worry, this muscle resembles gluteus maximus. When you see it in lower limb, see that gluteus maximus also cover a lot of structures. Then this guy covers coracoacromial ligaments, coracoacromial arch, and subacromial slash subdeltoid bursa. So this bursa is the largest bursa in upper limb. Largest bursa in upper limb. Okay, then the last but not the least, we've covered the capsule of the shoulder joint. Shoulder joint. Then lastly, it covers tendons of P major and long head of triceps, tendon of a major and long head of a tricep. Okay, so these are all about these muscles of the shoulder. Then let's do a quick recap. A quick recap. Look at sit DT. So one thing you have to know is that coming to okay, you already know this guy is supraspinous fossa the origin. This one is infraspinous fossa the origin. This one is a upper to third. It means that these two they have similar origin. So, the supraspinous fossa, infraspinous fossa, the two teres minor have similar origin. So this one is upper to third of dorsal aspect of lateral body. This one is the upper one third. Where is teres major? Upper one, lower one third of lateral dorsal aspects of the lateral body. Then this guy is what subscapular fossa. Then this guy, remember the V shape origin, which is what this one is the anterior aspect of the lateral half of the clavicle, lateral body of acromion, then inferior lip of the spine. Then coming to their insertion, these three greater tubercle, this one lesser tubercle, this one deltoid tuberosity, while this one medial lip of a bicipital groove. Coming to their action, this one does abduction of the arm. Do you understand? This one does abduction of the arm. So this one does abduction of the arm. Then this one does these two does the same thing. These two does the same thing. What are the two things this guy does? This one is abduction, this one is adduction and the lateral rotation. These two is what? Adduction and what? Medial rotation. Then this one does both flexion, extension, and abduction of the what? The arm. I think this is all for now. So we are going to look at the next topic, which is muscles of the arm. Thank you and remain blessed.